Out of all the sleep challenges that kids can go through, watching your child struggle with night terrors is perhaps the most alarming, perplexing, and concerning of them all. While most pediatricians will try to alleviate parents' concerns by telling them they're no big deal, they'll grow out of it, we dig deeper, and clinically we often see night terrors and any other significant sleep disturbance in young kids continue to show up later in life as other forms of sensory processing issues, emotional dysregulation challenges, just to name a few. Sleep is perhaps the most crucial of all of the core health functions, so when it's offline and not functioning properly, it's often a sign of other stress and trouble brewing within the brain and the nervous system for that child. So if you're concerned about your child's sleep, or you have specific concerns that they're having night terrors, or they had them in the past, this video is for you. We'll talk about the difference between night terrors and nightmares, and then we'll break down the root cause of sleep challenges in kids and what you can do naturally to help get things back on track for them. So night terrors, or sleep terrors like they're often called, are intense episodes of fear or dread that occur during deep non-REM sleep in children. It's typically between the ages of 2 and 6, and they're different from nightmares, and they can be distressing for both the child who's going through it and the parents who have to watch it happen night over night. So night terrors have distinct characteristics that set them apart from nightmares. They occur during non-REM sleep, and they're usually not remembered by the child, unlike nightmares. So night terrors can be more intense. They usually have physical components such as sweating or rapid breathing that go along with it. And children who struggle with night terrors will often present with an overactive sympathetic nervous system, which we nickname the gas pedal side of the nervous system. So this side of the nervous system, it's supposed to be able to fully wind down and shut off during sleep, but for many kids who had a stressful entry into this world with a birth intervention or trauma, or they struggled early on in life with common things like colic, reflux, constipation, chronic ear infections, that system, that sympathetic nervous system, is likely stuck on, and thus interfering with their sleep at night, leaving them more wound up and stuck in that fear and stress state than we would like. So night terrors can have short-term emotional and psychological effects on a child, as well as disrupt sleep patterns for the child and the parents. There's also potential link between night terrors and other sleep disorders or neurosensory conditions later on in childhood, such as sensory processing disorder, ADHD, and anxiety. These neurological links, they all go back to that child being stuck in that sustained sympathetic gas pedal on overdrive state. If you're watching this video, you've likely already tried creating that soothing sleep environment. You've done a consistent bedtime routine. You've bought all the white noise machines. You've used magnesium and melatonin and so forth. If you've literally tried everything and your child is still struggling, let's dig deep and get to the root cause by finding out if your child is stuck on that gas pedal side and in that sympathetic state. The number one benefit that parents report once their children begin getting adjusted is almost always an improvement in sleep first, because our adjustments work to activate the brake pedal and that rest and digest side of the nervous system, restoring balance to the brain, balance to the body, so your child and your whole family, honestly, can get back to getting a full, restful night of sleep, night after night. If you think your child's nervous system may be shifted and stuck on that gas pedal side, give us a call, send us a DM to learn about how we can help. We've got you.